Good news. The American Heart Association has determined that home-based exercise is both safe and effective for most people. Now, some people might still require supervised exercise therapy in a healthcare setting, so be sure your doctor has approved you for home-based exercise. The guidance for how to exercise in a safe and effective manner not only comes from the American Heart Association, but also from the American Association of Cardiovascular and Pulmonary Rehabilitation, the American College of Sports Medicine, the American College of Cardiology, and the European Society of Cardiology. Remember, your heart is a muscle. If you exercise the heart, it will get stronger, and you will be able to do more work with less effort. Your long-term goal is to get at least 150 minutes of moderate to vigorous activity per week. But you may need to build up to that. If you've had a heart attack or have had a procedure such as bypass surgery, angioplasty, or a stent, your level of fitness may be reduced. By following your doctor's exercise prescription, you can improve your fitness and reduce your risk of another cardiovascular event. In this series, we will arrange exercise in 3 phases: what you need to know prior to exercising, what you should monitor during your exercise session, and what you should look for after exercise. It is so important to keep a close watch on your body's signals. Know your numbers and exercise accordingly. That is the name of the game. Here are some basic things to expect when you start exercising. First, there's a direct relationship between your workload and your heart rate. That means the harder you work out, the higher you should expect your heart rate to climb. It's not normal for your heart rate to drop. If that does happen, check your heart rate manually to make sure the rate is accurate. If it is, let your doctor know. It could be a medication issue. Your blood pressure is composed of 2 numbers, the systolic, or the top number, and the diastolic, or the bottom number. Your systolic blood pressure should increase in a similar way to your heart rate. If your systolic blood pressure drops during exercise, recheck your blood pressure and let your doctor know. Your diastolic blood pressure may rise a little, stay the same, or even drop a little. That's totally fine. Now, your blood sugar, or your glucose, normally drops as a result of exercise. Be sure to test your blood sugar before you exercise. If your blood sugar is low, follow your doctor's instructions for treating low blood sugar. It's not recommended to begin exercising if your blood sugar is below 90 milligrams per deciliter or above 250 milligrams per deciliter. Make sure to have a carbohydrate snack nearby and make sure you're well hydrated. Your healthcare professional might also ask you to monitor your blood oxygen saturation. A normal reading is anywhere between 92 and 100%. It's not recommended to exercise if your oxygen saturation is below 90%. These are just a few tips to put you in charge of your own health and your workout so you can be the most productive. Before you begin exercising, it's important to consider a few ABCs. First, how are you feeling? If you don't feel well, don't exercise and contact your healthcare professional. Second, have you taken your medications as prescribed? And finally, if you've experienced any symptoms since your last session, contact your doctor before proceeding. And if you're experiencing any chest pain, dial 911. It's important to get acquainted with your own personal numbers, like blood pressure and heart rate. Unless otherwise instructed by your doctor, your resting heart rate should be between 60 and 100. If it's outside of this range, contact your healthcare professional before working out. You may also monitor other vitals, like your weight, heart rhythm, blood glucose, and oxygen saturation. Your doctor will provide you with the correct ranges there. A normal blood pressure is less than 120/80. If your blood pressure is elevated, get specific instructions from your doctor. If your blood pressure is greater than 180/120, you may be experiencing a hypertensive crisis and you should contact your doctor immediately. If you have diabetes, you should monitor your blood glucose. Get specific ranges from your doctor and instructions for when your blood glucose is too high or too low. Be sure to have water available before, during, and after your workout. Proper hydration is really the key to a productive workout. Keep your own personal ABCs in mind when preparing for your workout. Before you lace up your sneakers, you should have an exercise prescription that includes how long, how often, and how hard you should exercise. Ideally, this is based on a graded exercise test or a 6-minute walk test that's conducted by your doctor. You should try to be physically active for a minimum of 30 minutes most days of the week. Consider at least 3 monitored exercise sessions per week, supplementing the other days with an active recreational activity, something like walking. The duration of your exercise should be 20 to 60 minutes. Try to include rhythmic activities like walking outdoors or on a treadmill, cycling outdoors or on a stationary bike, or even using an elliptical, a rowing machine, or other activities designed for cardiovascular fitness. You should also include resistance training, something like weights or bands, flexibility training, and core training. Finally, you should know the intensity or how hard you should work out. The intensity can be based on a few things. Your target heart rate. Your doctor will give you a target heart rate or a heart rate range that you should strive for. If your heart rate is above the upper limit of the range, you should slow down until your heart rate is within the range. If your heart rate is below the lower limit, you should speed up until your heart rate is within the range. Your rating of perceived exertion. Now, this is a scale from 0 to 10 based on how hard you feel you're working. You should be exercising at around a 3 or 4. If you're at a 6 or higher, you should be slowing down. If you're using the 6 to 20 scale, you should be exercising at a 12 to 16. Your breathing. You should be able to hold a conversation or be able to pass the talk test. If you can't, that means your breathing rate is too high and it is time to slow down. Your symptoms. Anytime you have a symptom like chest pain, shortness of breath, dizziness, lightheadedness, fatigue, swelling, or pain, you should stop the workout and discuss with your doctor. If you're experiencing chest pain, you should stop immediately. And if the pain persists, you should call 911. Your workload. Finally, you can base the intensity of your workout on the settings on your exercise bike, like the speed, the elevation, watts, or RPMs. The exercise prescription is your own personalized plan. It's designed to set you up for success so you can get stronger every day. Welcome to your workout. During your exercise session, it's important to monitor how you feel, including any symptoms you might have, your heart rate, perceived exertion, and the intensity of your exercise. If you're ill or experiencing any symptoms, stop exercising and contact your doctor immediately. If you're having any sort of chest pain, dial 911. And if you're feeling fine, well then gradually increase your intensity over the first 3 to 5 minutes of your workout until you get to your target heart rate zone. At right around 3 minutes into your exercise session, you should begin to monitor your heart rate and perceived exertion. Try to calibrate your pace at this heart rate. Think about Goldilocks here. Not too hard, not too soft, but just right. There are 2 perceived exertion scales. One scale is between 0 and 10, and the goal is to be between 3 and 4. The other scale is between 6 and 20, and the goal here is to be between 12 and 16. Make sure that you and your doctor are using the same scale. As you get stronger, you can do more work with less effort, and that is the goal. It does take time and consistency, but just keep at it. So you've rejoined the world of exercise. Congratulations. If you've just enjoyed a good workout, it's time to think about the cool down. This is when you gradually decrease the intensity over the last 3 to 5 minutes. For example, if you're walking, slowly progress from a brisk walking pace to resting. The cool down is your chance to monitor your vitals until they're back to within normal limits. A good rule of thumb is to wait until your heart rate is within 10 beats of resting. Also, it's a good idea to measure your blood pressure when you're done working out. If you have diabetes, you may also want to take a post-exercise blood glucose reading just to make sure your blood sugar has not dropped into a low hypoglycemic range. As you monitor your heart rate, reflect on the exercise. Was it too easy, too hard, or was it just right? Did you have to stop or slow down for any reason? Did you experience any symptoms during the exercise or even during the cool down? It's important to get your personal exercise regime just right, and the cool down is really a key component of that process. Before you know it, you'll be an exercise pro and well on the way to your ideal heart health.